That says surrounding area.
Thank you. Yes, it's really the sound of the ocean that I want in my head. I wish I was there. Okay, we are doing anterior shin splints, anterior tibialis or medial tibial stress syndrome, posterior tibialis taping. Meaning, somebody has pain here or somebody has pain here. Or they can have it kind of like the length of the tibia. Usually there's one focal point. If you're palpating along the medial border of the tibia, what muscle am I palpating here that crosses behind the medial malleolus and inserts right here? What muscle is this?
Posterior tibialis.
Thank you. The posterior tibialis, tibialis posterior.
Yeah.
Can you palpate it?
No, oh, absolutely.
Oh, really?
Yeah.
So
It's
superficial?
It's deep behind the tibia, so it's in the deep posterior compartment, but there's nothing else right here other than the tendons of the flexor digitorum longus and flexor hallucis longus. Right? You see what I'm saying? So that's what you got going on right in here. Okay, maybe you can't palpate the whole length of it, but you can definitely dig in there and feel it. Tender? Should have asked you that prior. Okay, anterior tib, go ahead and dorsiflex all the way up. Crosses over like this. Can you guys see her bodybuilding muscle right here? She's been doing a lot of dorsiflexion exercises. Do you guys see this? Okay, this is not as common, but people present pain with the shearing forces of the muscle pulling away from the bone on the periosteum, which is your Sharpie's fibers. That's a test question, I believe. So you know what I'm saying? Okay. All right, so what you're going to do... Sure. Yeah, you getting tired?
No, I was wondering.
What you're going to do for taping is support the Sharpie's fibers with the tibia. So if she has anterior tib pain, make a note. If she has anterior tib pain, you're going to pull medial to lateral. So you're going to support the muscle into the bone so it's not pulling away from the bone causing the pain. If she has medial tibial stress syndrome, you're going to tape lateral to medial, supporting the posterior tib on the tibia, supporting the Sharpie's fibers, not increasing the tension. So if I'm doing this leg, can I see this leg? Right? It's lateral to medial. Lateral to medial. For anterior tib, medial to lateral. Medial to lateral. Okay, so we're just focusing on her right leg right here. She's going to take her foot into full dorsiflexion. I'm going to tape anterior tib pain first. So I'm spraying. I'm going to pre-wrap her like she's a racehorse. From right above the malleoli to the cut in the gastroc. You don't want to tape on the muscle belly of the gastroc. That's going to be uncomfortable. Even this is uncomfortable on some people. So it's like your shaka again. Anterior tib, right? That's what I said?
Yes.
Which direction do I pull? Okay, and then this is the other key thing. Always go distal to proximal on this one, facilitating lymphatic drainage. So here's a series of anchor strips. Like you did tape the ankle right at the cut of the gastroc, right? Now you're going to start distal, still matching the contour of the lower leg with your 3-finger tear, overlapping half the width of the tape, 3/4 of an inch in subsequent strips, moving distal to proximal.
You naturally put it at an angle. I noticed your first tape.
Well, you know, it's going to be different on different people. See how the angle becomes more dramatic as it V's out, as it goes into its flare?
That's 5, right?
Yeah, I don't care how many you put, it's the same thing as we just did for the arch. You're just making sure you're covering the anatomy of the individual, your landmarks, the malleoli to the cut in the calf, and then you repeat the exact same thing. Okay, so what am I taping here?
Medial to lateral.
But what structure? What's the purpose of this one?
Anterior Tibialis.
Correct. Okay, so on her left leg, I'm going to do medial tibial stress syndrome, okay? Okay, so there's that. And now I'm going to do this one. Okay, so now her pain is going to be on the posterior tib. I'm going to take her in dorsiflexion. I'm spraying. Shh. Can you move this one out of the way? Sorry.
Don't want to get any of that spray on.
And I'm doing my pre-wrap. Single layer, a little bit beyond where I'm going to tape. Still going distal to proximal, matching the contour of the leg, but now I'm going lateral to medial. Right? Am I doing this right? Are my words matching my actions? And then, guys, this one's so easy. It's going to help you with your anchors, but the big thing is to practice your three-finger tearing here. It's going to help you with time, accuracy, and precision.
You're doing that with your left hand.
I am, yeah. I switched it up.
Left hand.
Well, no, I was taping right-handed there, actually, with the spool in my
I'm
right
saying
hand.
you're
I know.
ripping
Because I was going the other direction. I would have preferred, I mean, this isn't my prettiest one. I would have preferred to do it the opposite way, but hey, I was
coordinated.
talking. Well, you can do it whichever way you want. You can cut. That's a wrap.